Today, being the 50th day of svasthya365, we are going to see one of the occupational diseases, silicosis. Silicosis, also called coal worker pneumoconiosis, is an interstitial lung disease where you inhale tiny particles of silicon dioxide in the form of unbound, free crystalline silica, usually quartz, or less commonly by inhalation of silicates, minerals containing silicon dioxide bound to the elements just talc. It is the oldest known occupational pulmonary disease. Symptoms and causes were officially defined in 1930 in an international conference in Johannesburg by a physician who had to conciliate the economic interests of industry and demands of workers' union. Silica is a tiny crystal found in sand, rock, and mineral ores like quartz. Since it is an occupational disease, it means that people who are working in a specific job are more likely to encounter this disease than others who don't work in the job. These jobs include mining, glass production, metal work, sandblasters foundry, gemstone, and ceramic workers and potters. What are the major risk factors? Major risk factors include duration and intensity of exposure and form of silicon. Crystalline forms pose greater than non-crystalline, and also smoking. After inhaling silica dust, they settle down in interstitial space. This is then engulfed by alveolar macrophages. This in turn causes inflammatory response, thus releasing of cytokines like TNF, growth factor, etc. When macrophages die, they release silica into interstitial tissue around small bronchioles, causing formation of pathognomic silicotic nodule. These nodules contain macrophages, lymphocyte, mast cell, fibroblasts with patches of collagen. As they mature, the centers of nodules become dense balls of fibrotic scar with classic onion skin appearance and surrounded by outer layer of inflammatory cells. Many such nodules coalesce to cause progressive massive fibrosis, thus reducing lung volume and function. And now, what will be the signs and symptoms? It takes around 5 years for symptoms to appear. Progressive dyspnea, protective cough, coexisting chronic occupational bronchitis, consolidation pulmonary hypertension, and respiratory failure, with or without cor pulmonale. Weight loss and fatigue, and finally respiratory failure often develops within 2 years. How can we diagnose silicosis? Patient usually comes with history of breathlessness and job exposure, occupational history of silica exposure, chest X-ray or chest CT which shows characteristic ground glass appearance, tissue biopsy for confirmation, ABG to monitor progression of treatment. What are all the measures taken to treat silicosis? Actually, prevention is better. Removal from further exposure, symptomatic treatment, example bronchodilators and inhaled corticosteroids. Oral corticosteroids, whole lung lavage, rarely lung transplantation. Thank you. Please like the video and subscribe to our channel Rotary Club of Savitha Medical College. Thank you.